An ordinary Monday night in late October, and this suburban Brisbane home was plunged into chaos.
I'd just made some dinner. I was walking over this way with my plate, and as I went to cut around through here, I tripped on one of the girls' toys, and that was it, straight through the window. As soon as I looked down and saw the size of the wound and heard the blood starting to spurt, it was when I knew the severity of it.
Ambulance, what's the town or suburb?
Elliot had cut 2 arteries in his arm. His wife Sarah called 000 and ran next door to get her retired paramedic neighbour.
So the first conversation, I explained what had happened. They said that help was on the way and that it was lights and sirens, they were coming.
As they waited, they grabbed household items to use as tourniquets.
That was 2 of my belts and a phone charger cable, and we had all 3 around him while we waited, and then it was getting to the point where we needed to ring again.
It was at that second call, around 10 minutes after the first, that panic set in.
My neighbour explained who he was, a retired paramedic of 35 years, and this was a Code 1 emergency, and Elliot was bleeding out on the floor. Unfortunately, that paramedic took that as abuse and decided to end the call. She said, "You couldn't speak to me like that, sir, so if there's anything else, call back," and she hung up on us.
Ambulance, what's the town?
After another 10 minutes, Sarah called 000 a third time.
By the end of the third phone call, I had said, "What are we going to do? Are we going to have to take him ourselves?" And they said that was up to us. And I ended the call, and then they called me back and said, "Do you want us to cancel the ambulance?" And I said, "No, I want you to come here and meet us on the way."
By this point, more than 30 minutes had passed and Elliot was losing consciousness. They decided to drive him to the closest hospital in their neighbour's ute, and Sarah applied pressure to the wound as they drove.
So as soon as we set foot at Redlands Hospital, we had the whole emergency department with him straight away. Due to the severity of the injury, doctors, nurses, everyone trying to stop the bleeding so he would survive.
It took the hospital 2 hours to stabilise Elliot for transfer to the bigger Princess Alexandra Hospital for surgery. Fortunately, doctors were able to save his hand.
I've always been told that when you call 000 in an emergency that they will be there, and the extent and the severity of Elliot's injuries, I thought that it would be about a 5-minute wait, if that.
The Queensland Ambulance Service's own targets state that an ambulance should be on scene at the most serious emergencies within 8 minutes, at least 50% of the time. For the rest, that target jumps to within 16 and a half minutes. A week after Elliot left hospital, members of the Queensland Ambulance Service visited their home.
The gentlemen that came to see us were sincere, and they didn't try to hide anything. They laid it all out on the table. We're not blaming the ambulance service. We want to know, systematically what causes things like this to happen, not just for ourselves, but for everybody that thinks you can pick up the phone and get an ambulance whenever you need.
After Sarah posted about her family's experience on social media, the opposition asked about it in Parliament.
I understand that the Queensland Ambulance Service has offered an apology to the family, that they have personally met with the family, and it's absolutely tragic what happened there.
Ramping happens when there are just not enough beds. People are living longer and sicker, and they present to hospital with very complex needs. There are delays getting the elderly into aged care, and overall, the number of hospital presentations is outstripping population growth.
It's not just the problem that's affecting the big metropolitan hospitals, it's also happening out in the country areas.
Dr Malcolm Boyle spent 35 years as a paramedic in Victoria and is now an academic. He's studied ramping as an issue Australia-wide and wants to see greater cooperation between the Commonwealth and state governments and more funding for GPs and allied health.
Instead of putting all the pressure on the emergency department, try and bring the patient load back out into the community and handle it at the community level instead of everybody ending up in hospital. Hospital should be the absolute last resort for people. That includes the emergency department.
It's actually a whole of hospital problem that plays out in the emergency department in terms of filling up our department because those patients haven't got any bed to go to, and then there's a knock-on effect to our paramedic colleagues.
At the Royal Brisbane and Women's Hospital, Director of Emergency Medicine, Dr. Sean Rothwell, has been working with the state government on solutions.
Discussions have been really good, and I'm glad we've come up with some initiatives that we settled on after our meeting. They look at a couple of different things. One of them is admission avoidance, and that's actually the best initiative and the best focus for improving access block and ramping, because if we can keep people out of hospital, not using a hospital bed, then that helps us have that bed for someone else.
The state's health minister announced a 5-point plan last month after meetings with hospital leaders. It included funding initiatives to steer people away from emergency departments where possible and increases to the number of nurses.
We've put on extra nurses, but because of the demand we're seeing and because we're seeing such high, acuity patients are sicker, we need more nurses helping with triage so they can get triaged more quickly, and again, so our paramedics can turn around and get back on the road.
I don't think the 5 initiatives are going to make ramping vanish. I don't think anyone thinks that, but what we're trying to do is, in incremental ways, try and improve the problem.
The state government says it's investing $11 billion in infrastructure projects and programs, including 7 new satellite hospitals to relieve pressure on the system.
I think the Australian emergency system is still one of, if not the best in the world, and we certainly don't want our community thinking that we can't look after them if they're sick. We absolutely can, and we are here to provide that best care.
Unfortunately, I wouldn't be calling an ambulance again in that situation when it's a life or death, and I've been let down once before. It's not going to happen again. I'll be driving straight to the hospital. We won't be waiting. We won't be making a call.